The goal of the pulmonary function test is to measure resting lung volume, which enhances the interpretation of these volumes during exercise. The measurement of vital capacity requires that an individual blow as large of a breath of air as possible into a spirometer. Thus, the person expels 3 of 4 components of the total lung volume: the inspiratory reserve volume, the tidal volume, and the expiratory reserve volume when performing the vital capacity. It provides an indirect indication of the size of the lungs. Having a large vital capacity can indicate high aerobic performance, which would be beneficial for an athlete or physically active individual to know to better improve their fitness. In our test today, we will use spirometry, which is the first and most common lung function test. It measures the forced vital capacity, FVC, which is the amount of air you can exhale with the force after you inhale as deeply as possible, and the forced expiratory volume, FEV, which is the amount of air you exhale at 1 second.
The equipment necessary for the pulmonary function test, spirometer, is a digital handheld device. You turn it from off to FEV1 setting or the FVC setting. In order to make the test sterile, we use a cardboard cylinder and place it in the front. In order to block airflow out of the nose and to make the test more accurate, we use a nose clip. In order to set up the test, you'll explain the testing to the client. Have them take the spirometer and place the cardboard sterile cylinder into the spirometer. Have them apply the nose clip. It's best to be in a standing position, that way you can move more air out of your lungs. So you'll ask them to stand. Make sure they breathe in very deeply and set the setting to FEV1. Have them breathe as deeply as they possibly can and blow into the spirometer as they bend forward to expel as much air as possible.
There are different common mistakes that can be made when administering the pulmonary function test, one of which is the tester forgetting to administer the nose clips to the participant. Also, the participant not concentrating on inhaling and exhaling as much air as possible. Other considerations: there are different types of equipment you can use for this test. Another type is called the electronic type, which is the spiral lab, or wet spirometers such as the respirator and the vitalometer. The type of equipment used is totally up to preference because the methods for each are very similar. Also, one modification to consider is that a shorter forced vital capacity maneuver of 6 seconds could be better in young adults, but in older adults an expiratory time of greater than 6 seconds is needed to reach their forced vital capacity. Also, when doing this test, it is recommended that there be 3 trials, and when administering this test, a break time of 1 minute between each trial may be needed.